Peggy.com. Friends, for at least a decade, I have not had traditional health insurance. And in the old days, it was called medical insurance. I've been researching the history of medical insurance in the United States. Let me know in a comment below if you know when that started and what the first medical insurance company was in the United States. And then we'll have a little guessing game here in just a moment. I can do another video if you're interested. Let me know in a comment below if you would like to hear more about the history of health insurance, what happened in 2014 when it became unaffordable for many people like myself, and how it changed from being disability insurance and accident insurance. And then it was in 1965 when Lyndon B. Johnson signed into law the Medicare basically that was a part of the entire kind of socialistic government doodads that were offered to us in that period of time. So I can do a deep dive on that if you want. But what I really want to talk to you about is what I do instead of health insurance. Now, I just got the newsletter that comes out, and it's called I have my fake background right there, my virtual background. I'm not always in a place where I have a nice background to film, so this does the trick. So there is the Samaritan Ministries, and I will leave a link for you in the description box below. So let me just give you a little bit of background. Prior, let's see, so it's almost been 10 years. It was 2014 when I changed. And prior to that, I had been an employee at different colleges and universities. So I always had my health insurance paid for by my employer. And that is a very common scenario for people that work full time. That's one of the perks or the benefits, just like having your vacation time. Although now I think in the United States, sick days are required by the government. Maybe it is a state law, but I know that has changed over the years as well. Many people get health insurance through their employer. So believe it or not, if you've been watching my videos over the last few years, you know that I am no fan of Kaiser Permanente, which is the huge health insurance and hospital here in California. But for many years, that was the employer's plan, was Kaiser. And I actually was very pleased with the Kaiser care that I had. I didn't really have a lot of, procedures or anything, but if I needed to go just get whatever needed to be done, I had a $25 copay. So that means if I had to go see the doctor, that would be $25. So again, that would be like, let's just round it off to about 2010, up till about 2013. And then I had zero deductible, and the school paid for me and my husband as a part of the health, part of our benefits. And it was probably, I think they said it was probably around $300 a month, something like that. Then when I was no longer employed by the school and I was doing my own entrepreneurial work and so forth, I paid for my own health insurance, and I still had it through Kaiser. And so for my husband and I together, again, I feel like it was around maybe $400, $25 deductible. No, I'm sorry, $25 copay, no deductible. And then there probably were limits in terms of prescriptions and maybe hospitalization and that kind of thing. I'm very healthy. I never really had to use any of that. I'm not on any prescription medicine. So I don't recall exactly what that was, but I do know that it was affordable. So in comes, I think it was 2014 when everything was changed in this country illegally and unconstitutionally to require you to pay a tax if you did not have healthcare. And of course, that was intended to create this sort of scenario of healthcare for all. And trust me, I get it. I know people that did not have their medical costs paid by their employer. And I know that it was getting more and more expensive as the years went on. So I get it. Now, most states have some type of safety net for people like that who can't afford health insurance. Many of these hospitals and urgent care centers and other community centers would have a sliding scale for people to pay. Maybe that's just in California. Maybe it's not in every state, but I know that people were able to get healthcare at a sliding scale. And often, if they had to have emergency hospitalization or something, the hospitals had their own charities that were funded. And I know people personally who had 100% of their medical bills paid for through these charities. So I do not know anyone personally who fell through the cracks and didn't get health care that they needed. So that's just my own experience. Your mileage may vary. But what happened is I went from a person who was able to afford paying for my own medical care to somebody who was unable to pay for it. Because again, at this part, I was working part-time and I was running my own business. And so I didn't have an employer to pay for my healthcare. And the Kaiser fee that went from, like I said, it was just under $400. It was like $397. It suddenly went for the two of us, it went to $1,500 a month with a $5,000 deductible per person. And the per visit fee also went up. I think it was maybe $75. It was absolutely ridiculous. How in the non-spinning world can anybody afford that kind of medical care when you don't have an employer paying for it? And that's where all of these government subsidies come in. I didn't want a government subsidy. I didn't apply for a government subsidy. I don't even think that I could have qualified for it. I was probably on that edge of where I was making enough money that I couldn't qualify for the government assistance, but I didn't want it anyway. So I immediately canceled the Kaiser insurance. Back in the day, I remember thinking, if the government really wants to make sure that everybody is covered, why don't they just issue a debit card, for example, for let's say $5,000. It cost me and my husband roughly $5,000 a year for our medical cost. And that, again, we were able to see the doctor for $25. We didn't have any copay beyond that. There were no deductibles. So I thought if everybody got a card, they can choose to go to Kaiser or they could go to Blue Cross. And that way it would have still maintained the free market where these insurance companies still could offer the plans that they wanted, because now everything is strictly regulated by the government, what they have to offer at different levels and so forth. So for a long time, I did not have any health insurance at all. I just refused to pay for it. It was my own non-compliance back in the day, just like now. I never saw the legitimacy of me being forced to have health insurance when I'm a healthy person. And I would pay out of pocket. I did have a broken foot some years ago, and I just went to the doctor and I told them I don't have health insurance. It was kind of funny because I was in the waiting room and the girl at the desk kind of blurts out, "Who's your health insurance?" Which I thought was kind of weird. Everybody's sitting around. And I said, "Well, I used to have Kaiser until the Unaffordable Care Act came around, and now I can't afford it. So I pay out of pocket." And I said that for everybody to hear. And the good news is that when you pay out of pocket, it's actually cheaper than when you have your health insurance. What I mean is that maybe it's not 100%, but every experience that I've had, and I'm going to tell you about my health care sharing in just a moment. But every time that I have paid out of pocket and I've told them I'm a cash patient, I'm a private pay, those are some of the phrases that you use, I'm paying out of pocket, that kind of thing, they normally reduce the price. And they reduce the price because they don't have to pad the bill in order to get the reimbursement from Medicare or the insurance companies. So for my broken foot, the doctor's visit and the x-rays and the cast came out to a total of $50. And I think that was fair. And the doctor apparently thought it was fair because he would have had to pad that bill in order to get the $50 reimbursement from whoever he submits these claims to. Plus, there was no paperwork, no staff was needed to do that. So he felt that was a fair fee, and I thought it was a fair fee. When we look back at the history of healthcare, that's how it used to be. You would just pay for your services as you go, kind of like car insurance. You have car insurance in case you're in an accident or you have major damage to your car, but I do not know of any car insurance that pays for your tires and your brakes and your oil and gas in your car. So why should these insurance plans pay for all of those other things? Now, my mom was in the medical profession for over 40 years. She worked in the ER. So she was all about trauma medicine, patch them up, get them out. She did not care for the mainstream medical merry-go-round. And she did tell me that when these, medical insurance things changed, people would show up all the time because they felt like they were getting care for free. Whereas normally maybe they had a headache or a stomach ache, maybe they would wait 24 hours, take a nap, a couple aspirin, see if they felt better. Now they felt as if any little thing they could go running to the doctor because it was covered. Let me know if you have experienced that or if you can relate to what I'm talking about. So as time went on, I realized that I did want to have some kind of coverage in case there was an accident or some kind of illness that would have been more difficult for me to pay out of pocket. And this is where I researched different Christian health share ministries. This is not medical insurance. It is not health insurance. It is a sharing group, and it's fantastic. I'm going to explain exactly how it works. It may be different because I've belonged to this with my husband for many years. So their program may be different. I'm not giving you any advice. I'm not going to, your mileage may vary, as I said previously. I'm just going to share my experience. So for the two of us, it is around $400 a month. We do not send a check to any insurance company. We send what is called our share, because it's a health share ministry. We send our share to another member in the ministry. So we get a statement every month that says, this person is in need of healing and prayer, and here is who we would like you to send your share to. And so we send a check. We send, actually, I'm not going to take that right now. Speaking of doctors, we send a check to the person who needs to have our financial assistance. And then they actually get that check, they deposit it in the bank, and they use that for their healthcare needs. And that's what it's called. It's called a need. So when I had my eye surgeries, I had several surgeries to restore my vision. And here's what I did. I could go to any doctor that I wanted to go to. I did not have to be in any plan. I did not have to be in any group. I did not have to have any approvals. I could go to any doctor I wanted to. So this cuts out a lot of the middlemen. You can go to who you want to. You don't have to have any approvals. Now, the only sticking point is that because you don't have health insurance, you are paying out of pocket. And there are a couple of ways of doing it. If you have the means to pay for it right then and there, then you can pay for it. If you don't, then you would need to, again, this is not my advice, this is just what some people have done, then you would need to create an arrangement with the doctor whereby you pay the doctor after you get your reimbursement through the other ministry members who are sending you the money. And that usually takes about 3 months. Many doctors and medical centers are aware of this. Samaritan Ministries is the one I belong to. I will have a link for you. In fact, let me take you right on over there. This is it. It is called SamaritanMinistries.org, not to be confused with Samaritan's Purse or any other Christian organization. This is exactly what they say, a community of Christians paying one another's medical bills. So this is, I researched many of them. There are a few out there. This is the one that really appealed to me. It was the most straightforward. It was actually the least expensive. My husband and I pay, it's about $400 a month for both of us. Now, once a year, that $400 does go to Samaritan Ministries to cover their administrative cost of publishing these needs and sending them out in the mail and, following up on all of that. So when I had my need, I went to the doctor. I paid out of pocket. I got the discount because I was paying out of pocket. I have never been turned away from any doctor because I don't have health insurance. I tell them that I have the health share ministry. They're very familiar with this. And then I get a receipt, and then you submit your receipts, and there's a whole way of doing it online. And the only amount of money that I paid was $300. That would be, they don't really call it a deductible, but that would be your portion of that need. So anytime you have a different need, let's say I had to have, I don't know, a back x-ray or something like that, then that's completely different than my eye. But every single thing that was related to my eye, all of the prescriptions, all of the follow-up appointments, all of the hospitalization, all of the pre-op work, everything was covered 100%, except for that initial $300. These procedures were in the tens of thousands of dollars. It went on for a couple of years. It completely was approved, went through. Now they don't approve certain things like abortion. They don't pay for any kind of, birth control. And there are some other things that they don't cover. I think maybe psychiatric medicine, dental work. I think, they don't pay for glasses, but I had the eye surgeries because that was a medical situation. So you would have to read all of the things to see. And if you do have any pre-existing conditions, you would need to read carefully what kind of restrictions there might be. I don't know if there's a waiting period. I don't have any preconceived or pre-existing or preconceived conditions. So that didn't apply to me. What I love about this is the money goes directly to another person. So when I was recovering, I received checks in the mail that then I used to reimburse myself, because remember, I paid out of pocket. And if you had an arrangement with the doctor where you didn't have to pay immediately, but you paid later, you would use that money to pay your medical bills. The other beautiful thing about this is people would send letters and notes and cards and healing prayers. And so I felt like I was being prayed for. I was being cared about from other people in this ministry. It's absolutely amazing. Now, I'm not of the age of Social Security, or what is that called? Social Security or Medicare. But in the years that come, I understand that that's something that you have to you're required to get. So I don't have that. And I don't know how that would change what I'm doing right now. But because it's a health share ministry, I can belong to it. Even if I never have a need or make a claim, I can still belong to it. I can still send money to people that need that to help cover their bills. Now, in a blue moon, if I needed something, I don't know, maybe I had a rash and I had to go buy a cream at the pharmacy or something. If it's under $300, you don't put in for that need because $300 is the bare minimum. So for things like that, I do pay out of pocket. I really like this kind of situation because it reminds me of the way that healthcare used to be in the old days. Now, I remember, I don't really remember, but I know as a child, I don't think my parents had health insurance. I mean, it doesn't strike me as if they did because I kind of remember, my mom writing a check to the dentist or something. So again, it's not that clear, but I have a feeling that wasn't really that widespread probably until maybe the 70s, maybe the 80s. I need to do a little bit more research. If you're interested, I would love to do a video on that because things are really changing and they will continue to change as the powers that shouldn't be want to have more and more control over our healthcare. So let me take a look at your questions and comments and see if you have any questions here. Let me know if you are in a health share ministry. And Todd, hey Todd, can't wait to bring you on an interview one of these days soon. Tell about your story. He stood up against his employer and he writes that I'm speaking his language in the medical field. It's crazy to see what cash covers. The hospitals will take in any amount in cash just so they get something. That is really interesting. So that is something that the ministry, Samaritan ministry, actually will give you some how-tos, how to negotiate the bill if you want to, ways that you can ask for the discount. And again, there is so much that is padded into these bills that generally speaking, they are happy to take the cash. The other thing is, I'm all in favor of cash. I do not want to go to these cashless systems. Oh my gosh, I've been having such a difficult time. My bank was bought by another bank. And so they changed all my bank accounts and bank numbers and all of that. I can't even get to an actual person without waiting, seems like hours before I can speak to somebody. And even then, it's very convoluted. So we're so close to not having any control over our cash. So I want to keep that cold, hard cash. All right. Who Am I says it wasn't pushed until around the 1980s. That's very interesting. Okay. Yes, I like, okay, looking at a few others. Thank you, everybody, for being on board. This is an interesting comment. Vin Lago says, in the USA, if you have insurance of any kind, it's illegal for them to let you pay cash without filing an insurance claim. Well, you probably can pay cash for your deductible. Again, I have no idea how traditional health insurance works because I've not had it for many, many years. Okay. All right. Oh my gosh. Aletta said she tried to pay cash for her son, and they said they didn't accept cash. That's absolutely crazy. Flower Garden says, here in Minnesota, I paid $285 for an office visit paying cash. All I wanted was to get on migraine medications. Of course, they said they will have to run tests, which will be way more. I hope you'll find some healing in a natural approach as well. So if you are interested, I want you to go to this SamaritanMinistries.com. I've got something else I want to share with you too. So let me share my screen. And this is it, SamaritanMinistries.com. You can click in there, read all about the different sort of programs that they have, how to become a member. Look, oh my gosh, 30, does that say 30 million? Is my math right? Medical bills shared monthly? That's crazy. Okay. I must have the classic. Sharing starts after $400. Mine used to be $300. Again, I've not had a claim in a long, long time. Qualifying bills are shared 100% after the initial $400. Generous maternity care, ideal for families. Now, this is a little bit different. I'm not familiar with the Samaritan Basic. I think this is more like traditional where you don't have to pay out of pocket. Again, I want you to do the research. I'm just here to show you, since so many of you asked me about that. What I find astonishing is how expensive veterinarian care is these days. And, we've got a couple of older animals. They're doing fine, but I did have to take my cat in at some point. And it was like, oh my gosh, I cannot believe how expensive that is. So I'm all about the natural approach. And some of you asked me about, and I really appreciate it too. You've asked me about how I keep my health and my energy going. And I have a program that many of you went through called Mind Body Makeover. And that is over at thehealthyamerican.org. That was a live webinar that I did last year. I think it went on for almost 3 hours. And I gave you all of my personal details about everything from my shampoo and makeup and lipstick. Some of you are asking about my diet, my exercise, my sleep, my mental outlook. All of that, and how I made a drastic change in my life after the first 2 years of the hogwash. And I knew that that was going to do me in unless I started taking care of my health. So all of that is in a program called Mind Body Makeover. But my Mind Body Makeover, I contributed to a larger program that I want to show you. And I'm going to, let me cue this up for you over here. Do you ever have like a million windows open? That's kind of what I have going on. Let me take you on over to this holistic health bundle. Now, I contributed my Mind Body Makeover program, which sells for $19 on the website. But I contributed it to this holistic health bundle with over 100 different ebooks and programs. Let me know in a comment if you ever bought this bundle, because I've done it a couple of times over the years. It's $50. You don't pay me. You go to this website. I want you to use the link that I have for you below. And this is where you are going to get all of these ebooks and resources and checklists and videos and courses and classes, holistic nutrition, homeopathy, if you're interested, detox, herbalism, natural care. There's tons of testimonials here. Best investment I've ever made. She writes, I can't wait to get my hands into it. Thank you for making this affordable. $50 for the amount of content is absolutely incredible. So again, you don't pay me. I contributed to this group, and I want you to benefit from all of these programs. And even if you invested in this previously, I think there are dozens and dozens of additional new programs that were added. Here we are. Beating Lyme disease, diet like a dietitian, ultimate juice remedies. This is my buddy there, Johnny Juicer. Burnout and nervous system. Oh my gosh, there is so much good here. The reason I'm showing this to you is because I'm all about the preventative medicine. I actually don't even like to use that phrase. I'm all about staying healthy. I'm all about elevating my own physical, mental, emotional, spiritual, intellectual health so that I don't have to participate in the mainstream medical merry-go-round. Now, I know sometimes these things happen. You know, you break your foot, you get a rash, something happens, you have an accident, and you do want to be prepared. But for the everyday health, there are so many things that we can do that do not require any of that mainstream medical merry-go-round manipulation. So I will have a link for you below. Thank you, everybody, for being on board. You check out the SamaritanMinistries.org. It's so affordable. I've been so happy with it. I am grateful for all of the people that are a part of that ministry, because that is how you render all of those hogwashers insignificant. You work outside of the system to the best of your ability. And I believe personally that this has served me better than any traditional health insurance.